To discuss this further, we're joined by Chris Maloris, who is the UNAIDS Regional Community Support Advisor. Chris, good evening and thanks for your time. Firstly, how much of an interruption have you seen when it comes to the kind of services or even medication that people in the country have to get that are suffering from other chronic illnesses?
Yeah, thank you. Thank you for having me. Yes, we have seen some interruptions in terms of people accessing treatment, and some of it has to do with how people are able to get to the clinic, and once they're in the clinic, what kind of services are available. The stress, as you can imagine, that is experienced by the health systems, and having to divert perhaps some of the staff to COVID-related responses. So we've been supporting networks of people living with HIV to do a quick analysis of what their members are experiencing. And so the interruptions go anything from the person not being able to go to the clinic, the interruptions they see when they are at the clinic, and there are some system-related interruptions, but we have not seen yet that large-level stockouts that perhaps the numbers you indicated are showing.
What is it that governments, especially within the Southern African region, need to be doing right now to avoid a situation where you would see a 6-month-long interruption in the supply of medication?
Yeah. So there are measures that can be put in place in terms of ensuring the supply chain is not interrupted. That has to do with how stocks are procured and the estimates are done correctly, and there's support to ensure that those. There's also monitoring that is happening at the global level to ensure that stocks from companies that produce generics, such as the ones in India, that chain also is not interrupted. But there's a lot we can do also with how we support people living with HIV by providing them with at least 3 months, if not 6 months, of ARV supplies. As you've said, with the lockdown measures, ability to move is limited. People are also afraid. By providing them with more months, they also supports them in not being exposed to the virus by going frequently to the clinic. It also supports the clinic not to have to see the same number of people more frequently, and therefore can alleviate a little bit of their pressure. But we also need to consider some of the practicalities, that what people living with HIV are going through in their lives, and what the lockdown measures are doing to their lives. In particular, vulnerable communities, women who may experience gender-based violence, communities that don't have an option in terms of social distancing, sex workers who might have lost their livelihoods. So we just need to make sure that all our measures are accessible to everyone, and they are not discriminatory in any way, and support people to access as much treatment as possible, understand COVID and how to protect themselves. But more than ever, this is not the time to interrupt services. One thing we know about COVID is that underlying health conditions are a risk, so we need to keep all of our communities as healthy as possible.
Much of this, of course, is also dependent on the fact that there shouldn't be any changes in the kind of investments that governments are putting towards procuring this medication and procuring the services. But we also know that many governments, including South Africa, can't do the work of treating people with HIV and AIDS, tuberculosis, etc., without the help of other outside agencies such as, your USAID or whatever agency it is that would be pumping and helping keep those resources up. So are we seeing a change in the patterns, particularly of donors during this time, simply because every country is going through their own problems?
Yeah, I think that's an excellent question. In fact, we've seen the HIV-related donors to adapt very quickly and support countries to be flexible to ensure that COVID is taken into consideration on how those services continue. But we also have, it's a matter of resources in terms of money, but also people, the systems to be able to deliver. And South Africa is a perfect example of community and health systems working together to deliver services. that connection needs to be maintained and if not scaled up. The way that communities are able to design their own solutions and support together with the government to provide those services without discontinuity. That partnership goes beyond the money that we are mobilizing for both COVID and HIV.